Hi, my name is Dr. Greg Ellis with Rehab to Perform. Today I'm going to be talking to you about those painful injuries when we get kneed or kicked in the thigh. This is often called a dead leg or a Charlie horse, but is simply a deep bruise or contusion that is sustained in the quad muscle. These muscle contusions are often accompanied by pain in the thigh, a sense of tightness, an inability to comfortably bear weight, and occasional bruising and swelling. It is important to note, if you're experiencing excessive, rapid swelling, developing numbness or weakness in the leg, or are unable to bear any weight whatsoever, seek medical attention immediately, as these may be signs of more serious conditions. These contusions can take a few days to a couple of weeks to heal, and even longer for more significant contusion injuries. Emphasis in early rehabilitation is placed on regaining range of motion, light muscle activation, and low-intensity biking. In this video, I'm going to be reviewing a couple of exercises that you can use to reduce your symptoms and support the healing process while you look to get back to sport. With these exercises, it is likely that you will feel some soreness in the muscle. An ache or a dull quality of pain is okay. However, avoid sharper pain. So the first thing you're gonna wanna do when you get those dead legs or those Charlie horses, those contusions to the quad, is get some light activity. The bike is a great place to do that because it's non-impact. It's generally pretty well tolerated after these injuries and allows us to get a little bit of movement, the heart rate up, that blood flow into that leg, help that healing process out. Just start going nice and easy. As you get more comfortable, you can kind of get up to a more normal pace. Again, we're not trying to kill it here. We're just going for something light. Just get the heart rate up a little bit. You shouldn't be out of breath, but you'll go there for the allotted amount of time. No more than 10 to 20 minutes just to get some movement through that leg. For exercise number 2, we're gonna do some heel slides. Allows us to bend the knee without stretching out that quad too much, just working on some range of motion. Lie down on your back and just comfortably slide that heel towards your butt. It's gonna be sore, you're gonna feel a pull along that quad. You're just gonna respect that. No sharp pains, a little bit of soreness is okay, and you're just working into what you can tolerate. As you get more comfortable and as your quad improves, you'll be able to get that heel closer to that butt. For exercise number 3, we're gonna do what's called a prone knee bend. This is actually gonna start to stretch that quad a little bit, but nothing sustained. So start by lying down on your stomach here. You're just gonna prop yourself up, and if we're working on that right quad, you're just gonna slowly bend that heel towards your butt again. You'll feel a much larger stretch than the last one, than those heel slides. But again, you're just gonna respect that. Soreness, dull, achiness, that's okay. But sharper pains is not what you wanna push into. And as you get more comfortable, you'll be able to get that heel a little bit closer in. For exercise number 4, we're just gonna look at getting some light activation through that quad muscle, just to keep it working, pump some of that swelling, that bruising out of there. Sitting down on a chair or a bench, something like that, all you're gonna do is just lightly kick your leg forward. You may not be able to fully straighten the knee when you first start. Respecting that pain level, you'll just kind of go through it for comfort, just a little bit of a work through there. So that last part of the managing of those contusions or those dead legs is sometimes you get some swelling, not always, but occasionally you can get some localized swelling in the quad. A couple things you can do, using an ACE wrap like you might find at your local pharmacy, just some light compression around that thigh muscle, just to reduce some of that swelling. I'd also encourage you to elevate the whole leg, laying down on your back, head on the ground, knee above your heart level. Hold that for about 15 minutes, just relax, let some of that swelling drain out of the leg. Do that twice a day. As you start to feel better, you'll be able to more comfortably perform other, more dynamic, higher intensity activities. Return to sport is as tolerated in nature. However, it should be noted, returning too quickly can risk slowing that recovery and keep you from playing sport for a longer period of time. If you're having trouble returning to sport or pain persists, it may be helpful to get it checked out by a physical therapist or other healthcare provider.